for those of you who are not able to log in. Some people have really said that they need to sleep, so we'll record this one for them. A little background about myself. I'm from Kenya. My medical school was in Grenada, and then a long journey here and there, and now I ended up doing the Plab January 31st. I thank God I got a good score. I actually didn't expect it, but I decided, you know what, I'll try and help as many people as I can. So the purpose today, and I'll not waste any time, I wanted to discuss some strategies because I might not get to help everybody, especially those who are doing their exam maybe next week. So I'll see if I can give you all the advice that I can right now. If you have any specific questions, I think the chat is on. Yes, you can type in your messages. If you have private questions, you can always text me. I can give you my number again. It's +1 857 210 8740. Okay, so the main purpose is just to offer personalized help. I think with the Plab, it's a bit difficult to try and take care of everybody as a big group. Everybody's needs are very specific. So if you really need time with me, just, oh, you cannot see me? Can you see me? Are you? Oh, okay. Someone said they can't see me. Okay. I think, I don't know. If you want, you can maybe private message somebody else and they can help you. That way I can use this hour effectively. But I believe most people can see me, and we are also recording. Okay, so I said it's really important for you to know where you are going wrong in this exam and what you need to do to change it. That way you can not only pass a station, but really exceed in a station. So I'll begin some of the strategies that I have. The structure of the exam is, this is how I approach this exam. For every station, I had a grid in my, like a template in my head. So I would get the chief complaint, the history of presenting illness, review of systems, past medical history, physical exam, diagnosis, management, and then closure. So I really planned to have a good opening statement. This, you really have to leave an impression. So in your mind, you have to play what you're going to do. You read the question, you open the door, you go to the examiner first. Some people, you know, they got a bit mistaken and they went to the patient, they started talking. You lose points because it doesn't look like you're organized. So these things, you should really already be very sharp in and what you're going to say. So are you going to introduce yourself with 2 names, with your last name, as a junior doctor? So I opened the door, I went straight to the examiner, I said good morning, at least acknowledge them, and then I showed them my badge, and then I asked, may I proceed? Then I went to the patient. Good morning, my name is Dr. Washira, I'm a junior in this department. Or you can, if you remember what department you're in, I'm a junior in the A&E, I'm a junior in the GP clinic, but if you forget where you are, just say department, it will save you. Instead of saying, oh, I'm in the GP, and then like, oh, sorry, I'm in the hospital. Or can I see the paperwork? I need to review. So just have a statement. If your exam is in the morning, practice with good morning. If your exam is in the afternoon, practice with good afternoon, or just say hello, you know. So then I would ask the patient, what brings you here? And then they would give me their response. And I want to really zone in on, if a patient says this is what you should be thinking. So if the patient says, doctor, I have pain. What are you going to say? Most people say, sorry to hear that. Really, it's it's a bit generic just to say, sorry to hear that. I can understand that you're feeling pain. I really tried not to use these words, only because it shows that you're not personal. So if you're going to say sorry to hear that, you can say, please tell me more, or sorry to hear that. I can see that you're distressed. Please tell me more. You always want to start with an opening phrase. So you don't start right into, are you, where's the pain? What is this? Where does it radiate to? Is it associated with anything? You want to take care, and I've been telling the people who I meet with, you want to take care of the patient and you want to take care of the disease. There's so many brilliant doctors out there, but they don't know how to present the information. I want you to start looking at this patient as a father, a mother, a husband, a wife. They're getting married next week. They lost a loved one. They have a life. They're dealing with bills. And you have to take care of this aspect of the patient, just because you're a good doctor, but also because IPS is heavily dependent on whether you can cater to the humanity of the patient. The disease and management doesn't change, but how you interact with the patient is one factor you can play with in this exam. As I was preparing, I said, I need to try and maximize and get a 4 in every IPS station. I literally said, every patient who I interact with, I want them to feel that they have come to the right place. They came to the right clinic and they met the right doctor, not because they were really super smart, but because they heard what I told them. They didn't mess up my name. They didn't rush through the case. They had good body language, So these are the type of things that maybe we don't work on too much. As much as you work on the management, you have to work on this. Okay, so let's go back to the patient says, I am sick. I have a headache. I have a stomachache, all this. There are so many ways you can respond to this. So you can say, I'm sorry you have been feeling this way. Please tell me more. It would be a good habit for you to say, please tell me more. Because also at the beginning of the interaction, you want your nerves to settle down a little bit. And this is just basically for the cases. Because now if you're dealing with an angry patient, and I'll have to deal with angry patient breaking bad news at a different session, because these also have a good approach. Sometimes these patients are so angry, they don't even want to hear your name. You have to give them a chance to vent. And then you pick from what they've said. And then now you can continue with the station. Okay, so what ways to respond to I am sick? Sorry to hear that. Please tell me more is one way. Another way is, I'm sorry you have been feeling this way. Please tell me more. Another way is, it is good that you came, for medical attention. It is good that you have sought medical attention. Acknowledge them. Please tell me, when did the pain start? So you can first acknowledge and then get into your Odipara or Socrates or all these other ways that will help you fully expand the disease. I also had another way of response. I said, I can see that you're distressed by your pain. Please tell me more. Another way you can respond is, could you please tell me about how you have been feeling? So, okay, I'm sorry to hear that. Could you please tell me more about how you have been feeling? Or, I can see that this has been difficult for you. When did it start? So this is how you want to start a station strong, with a good rapport. And some of the rapports you can just even build by yourself. I'll tell you, for IPS, it does not come naturally, even to me, because I'm a bit of a shy person. So what I ended up doing for IPS, I went to websites and I typed in how to show empathy to people, how to speak to people who are upset. I watched videos on YouTube about how to break bad news to HIV patients. I watched about how to deal with angry people. I went even to business websites to see how they deal with conflict, and some of the responses are, my credit card has been stolen. How I can hear from your tone of voice that you are upset, sir. Like we can learn from the business. So I did some good research and I built a good foundation of how to respond, because your IPS is what is going to make you stand out on this exam. It's unfortunate that the way we have been training, some people are a bit scripted. But even we have been warned, don't be scripted, because if the patient changes one thing, then you are, you're totally lost. And then you start getting stuck in the middle of the station. And then these tiny little things are the ones that make you lose points. Because some people have done fantastic data collection, fantastic management, and then the IPS, because the IPS is so bad, they minus points for you on all these other sections. So that's how I began my station. So if a patient says, I am worried, you can just reflect it back to them. I can see you are worried. Please tell me why you are worried. Don't say, oh, don't worry. It's strange. So if you have a friend and you tell them I'm worried, and then they respond back, don't worry, it's so bad, because it shows that you've just brushed them off. Don't worry, we are here to take care for you. We're going to make sure everything is going to be okay. I totally understand. All these phrases will actually make you lose points. And it's interesting because even before I did this exam, I went to the GMC website and I looked up the stuff they've put down. Just Google and just type in examiner tips on how to avoid common errors in the Plab 2 exam. And some of the things they're saying is that the examiners are looking for a real interaction, not a scripted one, with the simulated patients. I know maybe some of you haven't had time to go through this, but it's really important just to see where people are failing on this exam. And even as you go in, you can avoid these pitfalls. So they're saying this means candidates are asking questions that examiners are looking for real interaction with a simulated patient. This means candidates asking questions that patients can understand. Not everybody understands what loose motions are. Oh, are you having loose motions? It's better to say, are you having any changes in your bowels or in your bladder? For example, like diarrhea or constipation. Just elaborate so that you don't have the patient keep asking you, oh, what does that mean? And then you say, oh, this means this. You're losing precious time. You want to make sure that the words that are coming out of your mouth are targeted. And if, I'll get back to how to deal with if you get stuck in a case, what you need to say. But these are just some of the things that they're saying. And the second reason they're saying on the GMC is like some candidates appear to be using stock phrases which they may have learned on courses or are just copying. So, you could think that you're doing really well by being on the script, but if 10 of us from one academy are sounding the same, we will all be deducted for marks, and you want to stand out on that day. So at least if you have time for this exam, write your own phrases on the sheet of paper and say, okay, the doctor responded like this. How can I respond to show that I better care for these patients? And then they say the third thing, you are expected to deal with the patient exactly as you would if you were the junior doctor. So if this patient is coming in with a complaint of lower abdominal pain, and at the door you have the differential of maybe appendicitis, it could be ectopic pregnancy, ovarian torsion, or diverticulitis, and you have these differentials in your mind, as a junior doctor, at least before you offer keyhole surgery, or before you offer, I practiced some time back with someone, and even before offering to replenish or to hook up an IV and start IV fluids, or to manage pain, they already jumped to giving a management of laparoscopy, to give methotrexate, and to do a DNC, forgetting that maybe this was a wanted pregnancy. So this patient is coming in with an alarm system. I'm pregnant. Maybe I'm really happy to have this baby, and we have been trying for 3-4 years with my husband, and the blood pressure is like 80/40 with a high pulse rate. You say, okay, we're going to admit, and we're going to start, we're going to check out beta HCG, start you on methotrexate, and then maybe you're going to have keyhole surgery to take out the ovary. And don't worry, you have another ovary on this other side, and you can have another. Like, you can imagine how the patient is just feeling so depressed by the time you are done. And then you're giving too much expert advice, and you're not focusing on what the junior doctor needs to do. So we really have to be careful about the management that we're giving to the patients. Okay, so if the patient says, I am worried, don't say don't worry. Just say, I can see you are worried. Agree with them first before you disagree. Just say, I can see you are worried. Let us confirm this condition first with this test. Oh, doctor, is it cancer? I can see you are worried about cancer. Why do you think it is cancer? Because in this exam, you want the patient to talk. They're really there to help you. They're really there to give you the clues. So even ask them, what do you think might be going on? Is there anything that I could have missed when taking the history? That question saved me, because I had forgotten the whole maftosa, and the patient said, oh, doctor, I'm a smoker, and I've been smoking for 10 years. And I said, oh, thank you so much for that piece of information. It is helpful. Like, acknowledge them in your own words. It'll help, and it'll go a long way. Okay, so we've tackled the patient saying, I am sick, and what you should respond to that. We've tackled the patient says, I am worried. Don't say, do not worry. Acknowledge, I can see you are worried. And then if the patient says, I want to make a complaint, this is a big one. If somebody comes and says to you, I want to make a complaint, you don't just immediately offer them pulse. Okay, you can go and meet the patient advisory liaison, whatever the S is, I forget. It shows that you're very indifferent. What I had written in my notes is that, okay, I can see that this has upset you. I can see that you are disappointed. Is there anything, and all these are just different ways to handle. Somebody say, I want to make a complaint, or I'm very angry. I can see that you are disappointed. Is there anything I can do to rectify the situation? I sincerely apologize that this has inconvenienced you. And even your facial expression, and even when you're showing sincerity, even just the body language, you lean in and you say, I can see that this is upsetting you. I can see that this is, there are all these little things. Maybe not even, I can see, not with your hands like this, at least show some sympathy. Is there anything I can do to rectify the situation? We value your feedback. That's something I didn't write that. I just added that one right now. We value your feedback. Is there anything we can do to improve? I sincerely apologize for what has happened. We can improve by offering training to our staff. We can improve by discussing the issues in our meetings, in our monthly meetings. If we are all trained to say root cause analysis meeting, it'll sound good for the first person who says it. But if there are 20 people who are saying root cause analysis, I feel bad for the last person who's going to say root cause analysis, because the examiner will be like, oh man, they all went to the same academy, or all of them are scripted. Just say, you know what, we usually discuss patient dissatisfaction on our unit, once a month. I will bring this complaint of yours up, and it will really help. It can also, and if they really push and say, I really want to complain, you say, okay, I'm going to have the consultant come in and speak to you about this. And then now you can offer PALs all the way after you've really tried, to convince them not to complain. Okay, so you can also say we can improve as a team with some of the suggestions that you can give. Is there anything you can recommend? And then I put over here, if they persist, you can say, okay, Mr. Smith or Mrs. Smith or Jane, I apologize. If you'd like to speak to the consultant on the team, I will have him or her come in and meet with you about this. This is how you do. This is how you pacify this situation. If you really offer, if there's a complaint and you just offer to push it off to somebody else to deal with, it might take points off you. Okay, if the patient says, okay, I am concerned about this, you can say, I can see you are concerned. If the patient says, I am confused. So let's say you're explaining something, and I know sometimes we may have been advised to not shake hands. But if you see that this patient will really benefit from a handshake, at least the ones who are thinking that they have cancer, you at least try and shake their hands. The whole, patting and reassuring, I just try not to do that, because sometimes they could be sitting so far, and then it looks awkward if you're like, and they'll be like, what is this doctor trying to do? Anyway, let's get back to the case. So if they say, I am confused, you can say, my apologies if I was not clear. My apologies if I confused you. Is there anything specific you want me to clarify, or do you want me to clarify anything? But apologize that you've confused them. And this also goes hand in hand. If, let's say, the patient's name is Jane, and then during the interaction, somehow you call her Jennifer, and then she tells you, my name is Jane. Hopefully you will not do this. If you're not sure about the patient's name, just let it go. I know sometimes, we have been trained to say, okay, Jane, do you have this? Jane, do you have that? Jane, do you have this? How about this, Jane? It really sounds awkward. If you remember the name, use it once in the beginning, once before the physical, and maybe all the way up at the end. If you forget it, don't risk trying to remember a name that you've forgotten. If you happen to say the wrong name, just say, I am really sorry, I apologize. Or if they correct you, say, thank you for correcting. In fact, this is one thing I had anticipated. I anticipated the things that could go wrong for me. First of all, if I say the wrong name, I am going to, first of all, thank them. Thank you for correcting me. And I really apologize that I used the wrong name. Don't say I'm bad with the names. Or maybe something will say, oh, I've been seeing so many people today. Don't even laugh. If you have a laugh, just swallow it. Don't laugh if you make such a grave mistake, like confusing somebody's name. If I make a mistake on someone's name, this is exactly what I would do. I would look down and say, even like in embarrassment, you show that you are remorseful, or just say, thank you for correcting me. I really apologize. You really zoom in on them and just apologize for this. A good thing is to know where your biggest weaknesses are and plan for them. If your Someone who maybe sweats a lot, when you're anxious, try maybe wear a black shirt. Nobody's gonna see it. As opposed to walking around with big sweat marks on your back and just saying, oh man, everybody knows I'm just freaking out in this exam. If you know that you get stuck in when talking to people and you say a lot of or I don't know, this type of things. If you feel like you're getting stuck, you should have like a safety net for yourself. Mine was, do you have any questions? And then I would think about what I want to say. Or I would say something like, do you need any clarification at this point? And in the meantime, I would be thinking about, I've done allergies, family, medications. And then you can also ask, is there something you want me to clarify? The only person who should know that you are stuck is yourself. You can always hide it with a question that is going to add you more interpersonal skills. Okay. Another thing, I don't know if I said it. If you forget a name and you say the wrong name, don't say that I'm not good with names. Just say thank you for correcting me and I apologize, or say I'm really sorry. I apologize for making this mistake. Okay, so we've gone through. The patient says, I am worried, or I want to make a complaint. We say, if you know how to respond, if a patient says, I am concerned, if a patient says, I am confused. Okay. If a patient says, I am dissatisfied with the care, some of my responses were, I apologize you feel this way. Was there something that happened during the care? So you want to find out the source. Was there something that happened that is making you dissatisfied? Again, don't say, don't worry, all these other things, or just say, find out the reason why. Don't immediately refer to the seniors. Don't be the doctor in this examination who for every little thing will do a referral. If they have a bad diet, if they're overweight. First of all, I never called anybody overweight, even though the BMI was 40. I would say you are on the higher side of weight, or you're on the lower side. The culture here is a bit sensitive, so you don't want to call anybody, overweight. Oh, doctor, are you calling me fat? It'll be hard for you to get out of that situation. So even referring like to dietary, or not dietary, but a dietitian. If you can solve this situation where the patient is saying, I'm eating I'm drinking a lot of soda, or I'm eating a lot of French fries, you can ask them, can you cut back? Would you want to substitute maybe one of your meals with vegetables and fruits? Do you like vegetables and fruits? And then you say, okay, and if this doesn't work, then okay, we can always add in exercise. But if this doesn't work, it would be good to have a dietitian sit down with us and discuss different ways in which you can lose weight, or different ways in which you can, manage your diet. Before if it's a situation of conflict and the patient is saying, oh, I'm dissatisfied because I'm hearing from the therapist to do this, and I'm hearing from this other person do that, first thing you have to do is say, I will investigate. So you take responsibility. I will investigate. I will look into the charts. I will make sure that I can see the root of the problem. I said here, I will go into the records and clarify what the original plan of treatment was. That way you're not referring to the seniors too quickly. If they're still dissatisfied, then you can say, okay, I'm going to have one of my seniors, take a look at this or give their opinion, or I'm going to check in with the consultant. But don't be too quick to push off the blame to the seniors. Even with, if the patient says, if this has really affected my life, you can say, okay, you must feel very sad. Do you have any close friends or family for support? Another way you can say, address this is, I am sorry you have had a difficult time. Do you have any family support? Like, you want to find out, you've addressed, okay, you have a problem. Do you have people around you who can help you go through this? I never used this response, but I said, if I ever forgot, you want to have at least one or two responses for every situation, so that if you forget one, you can always use the other one. But I also wrote down here, I wish you didn't have to go through all this. Do you have any family support? Okay, the happy patient. The patient says, I am pregnant. Uh, I am getting married. I'm a newlywed. These are easy points. You cannot let these points pass you by. So congratulations. This must be very exciting for you. Don't read. I was telling someone today, I can remember my patients. It's so funny. I did the exam on January 30th, but some of the patients, I can remember them. If I saw them on the street, I'd be like, oh, hey, you're the alcoholic fruit lady, or you're the thyroid lady. And I don't remember my examiners because I never paid any attention to them. You know how you invest so much in a case that you remember the person? This is how I would suggest you really take this case. Invest in this patient. If they tell you, if you happen to ask, okay, what do you do for work? I'm an accountant. Oh, do you like the job? Has how are your work dynamics? You get along well? Is there any stress at your workplace? Is this disease affecting you at work? And then it's also good to offer, if you'd like, some time off, I can always check in with my consultant to see if we can write you a sick note, to show that you're also caring for what they do. If they say that I went on vacation, oh, where did you travel to? Did you travel for work? In fact, I'm going to go back to the grid that I gave you before about a chief complaint, history of presenting illness, how you take IC, and then I'm going to tell you how you can appropriately put in IPS, because there's some situation where IPS really doesn't work. So you also have to have a feeling of, is this appropriate for me to say this at this time? And the only way you can know whether something is appropriate is if you read into the patient, read the signs that they're trying to show you. If they put their head down and they're looking down, or if they hold their head, you stop talking. You say, is everything okay? You look worried. You have to acknowledge all these little signs. I said to myself, even if somebody does a small, I would offer water. Are you okay? Your throat sounds a little dry. Would you like some water? And I'm smiling now because I was not smiling then. I was very serious. You also have to get into that game phase. So, and I remember there was one of the scenarios where something entered the eye of of the simulator, and I'm talking to him, and he kept on like doing this, and then like trying to really blink it out. And then I said, is something wrong with your eye? And then he's like, no, just keep going, keep asking the questions. So I took him out of character, because I'm like, I'm not going to let anything pass me by. If they sneeze, please say bless you. But pick up on all the little the little things that they are putting out there for IPS. Okay. Let's see. So I said, the last thing I said, okay, if the patient is saying that this has really affected my life, okay, you'll say, I'm sorry that you're having a difficult time. Do you have any family support? If the patient says, I'm pregnant, I'm getting married, okay, you have to think about if you get stuck. This was one of my biggest fears. If I get stuck, what am I going to do? And I think I must have mentioned it before. I said, if I get stuck, I would slowly just ask the question, okay, do you need any clarification at this time? I would take my time and ask it, and then go through Maftosa And I'd ask them, I would even say, am I going too fast? Would you want me to slow down? So these are this type of things. But if you get stuck, just make sure you're the only one who knows that you're getting stuck. At the door, I have my differentials. So what could some of her concerns be? She has a recent diagnosis with hypertension. So she could have questions about hypertension. She could have questions about cellulitis. She could have a totally different, question. She could say, okay, now my eye is paining. Can I ask why you were admitted? So you want to see the picture from the past, you want to see the present, and you want to see the future. So the patient will tell you, oh, I had cellulitis, and then while I was in the hospital, I got a diagnosis of hypertension, and then maybe they started me on some new medications, blah, 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 blah. And then congratulate them, in this one you say, okay, congratulations, but you would say, I'm glad that you're out of the hospital now. If they were admitted and they've survived the rigors of admission and now they're in the GP clinic, get some points with saying, okay, it's good that you were discharged. Any questions you have from the instructions they gave you at the hospital? No, doctor. Okay. So you're saying you have some leg swelling. Of course, you'd go into detail with the leg swelling. Is it bilateral? When did it start? Blah, blah, blah. So your first differential should be not DVT. Like, sincerely, if this person went to the hospital for cellulitis and is now having some problem with the leg, my first differential would be maybe the medications or the antibiotics that they gave her were not effective and the cellulitis has returned. So you can ask, is the leg swelling just like the one you had when you had the cellulitis? No, you will get exceptional points there because it shows that you've remembered why she went to the hospital. And you also know that cellulitis can be ineffectively treated. And then now you go into, okay, is it both legs? Is it one leg? Then you check if it's DVT. And then you say, okay, what else happened? You said you were started on some medication. Yes, doctor, I was given some lisinopril and I was given some painkillers. You really have to know when to give information and when to withhold. The FI2, as I had said before, really just manages to a certain level, and then they get expert help. Any question the patient asks, reflect. That's a good question. Thank you for that question. And then answer. This is how you get all these IPS points. When you're closing the case, you can offer the leaflets, you can say, okay, we can give you some documentation that has more information on this. If you have any questions, you can always call us. But thank you so much for coming. And guys, I'll tell you, I handshook everybody in my exam. This is something that I'm not hiding. I know we've been told don't handshake. Some of my colleagues have been saying that I can't, it may be a little be awkward for a man to shake a woman's hand. That's fine. But if it's an old person, my gosh, just shake their hand. Especially if it's breaking bad news. At the end, shake their hands. Well, friends, my time, 1 hour is up. In fact, I'm surprised that it's going on to 10:01. It should have just automatically logged me out. But I'm here to help. I have the WhatsApp group. Some people text me. Sometimes, if you text me in the middle of the night, I may get the message, the next day. For those of you who don't have my number, please, you can find it on the group. I'm also going to challenge you with maybe a new case. For example, if the patient walks in and says, doctor, I have pain in my mouth. Wow, I should have chosen something easier. So if the patient is saying I have pain in my mouth, okay, differentials. Is it a toothache? Is it gingivitis? Is it trauma? Did they bite themselves, or did they recently go to a doctor for this? How is it affecting their eating? So now, how I would get maximum IPS points in this station, I would zone in on nutrition. Have you been able to eat well? Has it changed your diet? How are you? It's very painful to have a mouth sore. Is it bleeding? What are you using to help it? Are you using any ice? Especially with what the patient is doing for management, you have to start with non-invasive first. What have you tried? Are you trying just like this numbing lozenges, or are you trying ice? Have you seen anybody for it? And then I would ask a question like, do you go to the dentist? Okay, because and I'm asking, and sometimes you can even ask all these questions, and the patient is like, why are you asking me all these questions? Sometimes if the patient gives you that signal, it's like, oh, you know what? I'm asking you all these questions to get a better picture of what is happening. Or I'm asking you all these questions to get a better understanding. Even after you finish asking all your questions, thank them. Thank you for answering the questions. I would now want to do a physical examination of this system. Never stop at, I want to do a physical exam. You have to say, I want, never, that is a very hanging answer. I would like to do a physical examination and take a look at your eye, or to check your thyroid, or to check your knees. But all this I can go into at another time. I'm surprised they still haven't thrown me out. So if they throw us all out, you'll know that the free 1 hour is over. But so even for the mouth sore, because it's a new case for all of us right now, and you can put your suggestions to help me. So I would because the dentists in this country are expensive, and it's not part of the care. So I was saying, have you had a chance to go to a dentist? When was the last time you went to a dentist? How do you take care of your teeth? Do you floss? Do you brush 2 times a day? Do you take sweets? So now even your differential, one of the differentials you want to do is make sure that they don't have a tooth cavity. Another differential I'd check is for this case, I would try and rule out some low immunity. So if have they been do they have HIV? I know maybe that's a little bit too far, but I would be looking for maybe CMV or herpes virus. Have you noticed the sore anywhere else on the outside of your lips? Has this happened before? And then I would really pull, if the station is new, I would pull, because you want to give yourself time to really dig into your medical books of first year and second year, and say, okay, what can I, as an FY2, yes, thank you, any stress, any stress, and you want to look into just the medical archives to see what can be causing this disease, and how can I manage it. I can manage it with pain medication. Number one, I can manage it with pain medication, and I can manage it by helping them with their nutrition. I can find a way to supplement their nutrition. If you feel like you're not eating well, maybe you can try some soups, some warm soups, or maybe some cold things that can help numb the pain. And I would also want the opinion of my seniors to better manage your case. That's what an FY2 can do, honestly. And if it's toothache, then you can refer to a dentist. I should have chosen an easier case, but I'm going to look into mouth pain and see how we can better manage this. But you will get points by being concerned about the patient, by leaving every patient with the feeling like, you know what, my gosh, I've seen 20 people in the morning and I've seen 20 people in the afternoon, but that doctor from India, my goodness, they were so good. Not that they were expert in knowledge, but I really felt cared for. I really felt, and even when I finished my exam, and I talked to my dad. I was telling this to somebody. My dad said, so do you think you passed? I said, you know what? Even if the GMC fails me for this exam, I would pass myself, because for the 18 stations, I tried my level best to make sure that these patients were heard. At least for that, I will get the points for. And thanks be to God, my score was good. But feel good about the cases, because not because you were able to give them all the management. If the fire alarm goes off, pick your passport and money and run out. Some people I've worked with, they're trying to drag the bed and the television and everything. And I ask them, why did you start talking about all this management? You only have 2 minutes. You at least try and get points for safety netting. At least get points for clarification. At least get points for asking the patient, what do you think this is going on? Or how has this affected your life? Okay, guys. Again, thank you so much. If you have any suggestions on what you want us to talk about, I know breaking bad news has been something that has been causing a lot of stress for many people, because breaking bad news stations are not hard, because this is I call them the social cases. This is the time for you to shine. All these cases of somebody forgot something, there's a complaint here, blah, 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 blah. These breaking bad stations, you can really shine. And even the Seaman stations, you can shine, because the management is where you need to focus on. Seaman, you should be like a scalpel. You should know the management in and out, because the examiner might try to stress you. Okay, by God's grace, they've let us continue until 10:09. But I'm planning to have another Zoom station, and maybe we'll start right at the 7 p.m. on Monday. Anybody who you feel would benefit, just let them know. And oh yes, also is the schedule for the Skype one-on-one practice is the same, or will you change it? So I made a big mistake, because when I put up the schedule, I never put in time for eating or traveling or doing anything. So I've learned the hard way to schedule, some time for me also to eat and travel to all these sites. The schedule I'm going to put up next week, I'll divide it to maybe people who are taking the exam in May can sign up here, in June, in April, so that maybe we can work together. Like, guys, maybe if you have the examination in June, let's try and help the guys who have the exam in April, so that they can at least get as much advice before they take the exam. And since I'm here until the end of June, then we can always work together. So text me, give me your feedback, whatever you want us to work on the next time. Next time, maybe we can do breaking bad news, and then we can take it to them. And also Simman. Okay. Thank you again. Thank you very, very much. I wish you all the best, those of you who have your exam next week. If you have a question, just ask. And also about resources, I wanted to really talk about it. Resources are good, but try and make these cases your very own. Like, put your own signature on them. Yeah. All right, guys. Thank you so much. It's time now for me to sleep. Bye. Bye. Thank you. Thank you. Thank you again.